Hello, I'm Dr Deb, the Travel Doctor. This travel health tip is about treating travellers' gut problems. Travellers' gut problems have many names: travellers' gastro, travellers' diarrhea, Pharaoh's revenge, barley belly, Montezuma's curse, and so on. It's all basically the same thing. Research has shown that this condition is due to a germ in your gut. And of course it's best if you can avoid getting this germ into your gut by being careful what you eat and drink. But all experienced travellers know that sometimes it just sneaks in there. So you need to know what to do to treat travellers' diarrhea so that you can get back on the trail quickly. The most important thing to know when treating travellers' diarrhea is that you should treat the condition early. The biggest mistake people make is they think, I'm not sick enough, I'll just wait. Well-meaning friends may say things like, you should wait, the diarrhea will flush the germs away and you will get better. And in fact, travellers' diarrhea will generally go away in 4 or 5 days. But that's a long time when you're travelling. The old recommendations were that you should leave travellers' diarrhea untreated. But current research has shown that you will get better faster and you will have less long-term bowel damage if you treat the diarrhea immediately. Travellers' diarrhea is defined as 1 to 3 loose bowel motions within 24 hours, and you usually have other symptoms like pain in the stomach or an urgent need to rush to the toilet. If you're sick with the diarrhea, you need to treat it. And the best treatment for travellers' diarrhea will depend on which country you're in and what your past medical history has been, so that you can take the right antibiotic for your diarrhea. So the way to approach travellers' diarrhea is once you get the symptoms, you start treatment. And in fact, I would recommend you carry these drugs in your day bag and on the aircraft on the way home. In fact, one of the commonest times people catch travellers' diarrhea is after their last meal before they return home, because people are really careful all the trip, and their last meal they lash out and the diarrhea strikes either that night or just as they're getting on the aircraft. And you don't want your medical kit to be down in the hold. I'm going to talk about the stepwise treatment of travellers' diarrhea. Many of these drugs are prescription items, so you need to see a doctor to get these drugs. And these medications are not suitable for everyone, so you do need to have medical advice before you use these steps. So what to take? The first step is usually a quinolone antibiotic, something like naroxen or ciproxen, and that is taken in combination with a stopper like Imodium or loperamide. That results in 3 little tablets: your Cipro or your naroxen and your Imodium. You just take those 3 tablets all together once. I call it the diarrhea bomb because it kills the germs and makes them go away. If you get sick with travellers' diarrhea and you take the antibiotics, you will usually get better within 4 to 6 hours. If you don't take them, it can take 4 days. The treatment of travellers' diarrhea is usually approached in a stepwise fashion, and you try different drugs because you're trying to guess which germ is causing the problem. Most travellers' diarrhea will be killed by the step 1 drugs, but particularly in countries like India and Nepal, these step 1 drugs have been fed to the animals, and so the animals are encouraging the breeding of resistant germs, so sometimes step 1 doesn't work and you need to go to step 2. Step 2 is to take another 3 tablets. I call this the atom bomb. The tablet that we normally use for step 2 is azithromycin, or Z, and you take 2 azithromycin with 1 loperamide or Imodium, so that's still 3 tablets to kill the germs. Step 3 is to take a tablet called Tinidazole. Now many travellers talk about Giardia and say, I've got this symptom or that symptom and therefore it must be Giardia. Well, studies have actually shown that you can't tell which germ is causing the problem by the nature of the bowel action. But if the other 2 bombs have not worked, then you need to take step 3. And this tablet is taken as 4 tablets all together, and that will usually fix the diarrhea within about 24 hours. It's important with Tinidazole that you do not take any alcohol for 48 hours after you take this tablet, or it can give you the most dreadful hangover. There is a type of diarrhea called Cyclo Spora. It's quite rare and it causes persistent diarrhea which can last up to 9 weeks. And the only thing that treats it is a family of drugs known as Bactrim or Septrin or cotrimoxazole. So if you're travelling long term and you can't get to a doctor, then it's worth trying some Septrin or cotrimoxazole to see if that will fix the diarrhea. So we've talked about the 4 steps that you need to work through if you get traveller's diarrhea. 80% of people will get better after step 1. Occasionally though, even if you take all these pills, it doesn't fix it. And that's because there are a few bacteria and viruses, particularly viruses like the norovirus, which are not going to be treated by anything. But usually by this stage, you need to seek medical advice. So we've talked about the stepwise approach to treating travellers' diarrhea, this very common problem that travellers get. If you follow these instructions, you should get back on your trail as quickly as possible and have a great trip.